Do you sometimes feel a tender lump on your neck, under your jaw, or even in your armpit when you're sick? That's not just random swelling. It could be your body fighting an infection. This condition is called acute lymphadenitis. It happens when the lymph nodes, small bean-shaped filters in your body, get inflamed, usually because they're trapping germs like bacteria or viruses. Think of it like a traffic jam in your immune system. When too many germs rush in, the node swells up trying to stop them. Ever felt a sore throat and then noticed a painful bump in your neck? That's likely lymphadenitis in action, and most of us have had it without even knowing the name. So what causes this swelling? It's usually an infection nearby. For example, a tooth infection or a cut on your arm can send bacteria like Staphylococcus or Streptococcus into your lymph system. Your lymph nodes act like checkpoints. They catch these invaders. But when they're overwhelmed, they become red, warm, and painful. Viruses like the common cold or flu can do this too. Imagine your lymph node as a tiny fortress. When enemy germs attack, the guards, your immune cells, rush in, causing a ruckus and swelling. In rare cases, more serious causes like tuberculosis or even some cancers can trigger it. But don't panic. Most cases are simple and treatable. How do you know if you have it? Picture this: you have a bad sore throat, and then you touch your neck and yelp, "Ouch, what's that hard, tender lump?" That's a classic sign. The swollen node may feel like a pea or even a grape under the skin. The area might be red, warm, and painful when touched. Sometimes you might also have fever, chills, fatigue, or even pus if it gets worse. If you've ever had a cold and noticed swollen glands, you've experienced mild lymphadenitis. But if the lump keeps growing, feels rock hard, or doesn't go away in 2 to 4 weeks, it's time to see a doctor. Pro tip: always check your neck, under jaw, and armpits during a bad infection. Your body might be trying to tell you something. How do doctors know it's lymphadenitis? They start by asking, where does it hurt? How long has it been there? Then they gently press on the lump. Not too fun, but important. If it's soft and tender, it's likely due to a simple infection. Blood tests or ultrasounds might help confirm it. For instance, if the swelling is behind the ear after a scalp infection, the clue is pretty clear. If the doctor suspects bacteria, they may prescribe antibiotics like penicillin or amoxicillin to knock it out. Warm compresses, like a clean towel soaked in warm water, can reduce pain and swelling at home. But if the node fills with pus, a small procedure called drainage may be needed. Remember, never pop or cut the swelling yourself. That can make things worse. Can you avoid it? You can't always prevent infections, but you can be smart. Think of it like locking your front door. Small habits keep bad stuff out. Wash your hands often, especially before eating or after touching dirty surfaces. Treat cuts quickly, clean them, apply antiseptic, and cover with a bandage. Got a sore throat or bad toothache? Don't ignore it. Early care can stop the infection from spreading to lymph nodes. Also, staying healthy with good sleep, water, and food boost your body's guards. It's like upgrading your immune army, so they can win battles fast and quietly, without a big swelling drama. Researchers are now using smart imaging tools like contrast-enhanced ultrasound to see inside swollen nodes without surgery. It's like upgrading from a flashlight to a mini camera. Other studies are testing rapid swab tests that can tell if bacteria or viruses are causing the swelling, helping doctors decide faster if antibiotics are needed. There's also growing interest in how the microbiome, good germs in your body, affects immune responses. Future apps might even let you track your lymph node size over time using phone photos and AI. While no big breakthrough drug exists yet, the focus is on faster, accurate diagnosis, so you get the